Hey there, everybody. This is Big Tom. Being prepared is a state of mind and a way of life. Today, I'd like to share some of the stuff I've learned about COVID-19, the coronavirus. Right now, it's on everybody's mind, and people are talking about it. I've been following this pretty much several times a day since the second or third week in January, and I knew this was going to be a big deal when Wuhan was shut down, city of 11 million people, because at the time they had 800 cases. And we've seen, and if you followed the news, the progression of this disease has really been incredible. It's been like nothing we have ever seen before. How seriously do I take it? You may have noticed in my other beard videos I had a full beard. I had that for the best part of 25 years. Cutting my beard down to this will allow me to wear a mask when it comes to that. And I have worn a mask going to the store lately. And the reason for that is not so much for my own health, but I'm at my bug out location right now with my wife, who, along with stage 4 ovarian cancer, has 5 or 6 of what they've identified as the comorbidities, the things that are going to get you extremely sick. There's a good chance if she gets this virus, it will kill her. And I'm not taking any chances with that. It amazes me. You look on the news and some of the young people still aren't taking this seriously. I have an engineering background and I look at the numbers, and that's how I knew early on this was going to be an issue. The WHO, World Health Organization, says that this has a 3.4% mortality rate, and that somewhere between 60 and 80% of the world's population is going to get this disease. Now, for the vast majority of us, that's going to be a bad case of the flu and nothing more. For some, it's not even going to be that bad. But for that, over 10% are having to be hospitalized, and 3.4% of those patients are not going to make it. When you think about the fact that America has about 325 million people right now, 80% of that would be 260 million affected. 3.4% of that is 8,800,000 people who potentially could die. Let's be real conservative. Let's say that it's a 2% mortality rate. That's 6,500,000 deaths in the United States alone. So this is serious, and we need to take care of everyone. To put it in perspective, in World War I, there were 116,708 deaths of U.S. citizens. World War II, 405,000 deaths. The 1918 Spanish flu that went around the world, that's the closest we have to this, that took 675,000 deaths. You total those all up and you're barely over 1 million. And this has the potential to kill between 6 and 8 million people in the United States alone. So this is serious business. It's several times more infectious. You can spread the disease before you have symptoms, before you even know it. And this is something we need to be very careful of. Some of the things I'd like to share, as a caregiver as well as a patient, my family and I have been over in 15 area hospitals over the past 40 years. I live outside of Chicago, and Chicago has one of the best medical systems in the world. We have several medical universities, university hospitals, medical centers, and I've been, at one time or another, me or my family have been to every university hospital in the city. The thing you need to understand is standard of care is not the same everywhere, even in an area like I live in. Once I had to remind a surgeon to wash his hands before he touched with his bare hands my wife's surgical scar to check it. Another time, I had to remind the nurses that my father was having trouble breathing because the oxygen he was on wasn't hydrated as it should be. The oxygen should go through a little bottle of water to keep it moist. He was also dehydrated because his urine was dark orange. These are obvious things, but the problem is when you have to deal with too many patients, one person, no matter how good they are, whether a nurse, a doctor, if they are overwhelmed, they're dealing with 10, 20, couple dozen patients. They don't have the time to devote to each individual patient like they would like to. You, as a caregiver to your family, are there with them all the time. You can provide the best overall care. We need doctors and nurses and first responders, and I have great respect for all of them, especially in this situation. But you need to be your own advocate. Medical professionals are experts on the human body in general. You are the expert on your own body. Don't be afraid to ask questions. Get informed. And if you're unsure of anything, don't be afraid to ask. The following is not intended to be medical advice, but it's a compilation of the best practices listed in the sources that I'm going to give you. Always check with your healthcare provider first. Here are some steps to prevention that I've gotten from China and other locations that seem to be helping keep this virus under control, this pandemic. So here are some steps to prevention. Avoid unnecessary crowded gatherings. Shop if you can online or when stores are less crowded. Use plastic, not paper, to pay. Remember to wash and sanitize your hands after touching keypads, elevator buttons, gas pump handles, public area doorknobs. Interesting thing about United States currency, it's not made of paper. It's made of a combination of, I believe it's linen and cotton. You can get it wet and you're not going to harm it. When I do have to use cash, I take hand sanitizer and I sanitize the cash. I sanitize the change. Cough into your elbow. Don't forget to disinfect the crook of your elbow. I believe it was Mythbusters did a study on this, that germs are spread much more easily by coughing into your hand rather than coughing into your elbow. Don't share food or drinks. Avoid travel if you can. Obviously, with most of us in a lockdown situation, that's become quite evident. Clean and disinfect any cuts before putting a bandage on them. Get plenty of sleep. 7 to 9 hours helps build the immune system. Eat a balanced, healthy diet with as little fast and processed food as possible. Consider taking a multivitamin. Dr. John Campbell has a YouTube channel that I've found to be some of the best information, all fact-based, on this virus. And he recommends for people who live in the northern hemisphere taking vitamin D at this time of year because vitamin D is produced by sunlight and we're not in the sun as much. When talking to people face-to-face, maintain a 6-foot distance to reduce exposure from coughs and sneezes. Avoid personal contact, including hugs, kisses, and handshakes. Don't use water fountains. Carry tissue with you and use it to push elevator buttons and the like, and then throw it away. They've been doing this in China, and it seems to have been helping. Avoid public toilets if possible. Sanitize them before using them. Yeah, it's extra work, but bring some spray disinfectant or a squirt bottle with disinfectant in it and clean the area before you use it. Sanitize sharpened car handles and coin-operated laundromats. A lot of us have to use coin laundry, and that's fine, but be aware that there are dozens, if not hundreds, of people using that equipment. They're touching it, and they can spread the virus that way. Telecommute to work. from home if you can. If that's not possible, sanitize touchscreens, keyboards, mouses, machine controls. If you have to work in a factory, that's fine. Sanitize your workstation before you start using it. And as always, sanitize and wash your hands as frequently as possible. Here are some steps if you get sick. Wear a mask as soon as you realize it. Go to the hospital, but call them first before you go in case they have any special instructions. We're trying our best not to overwhelm the healthcare system. If told to quarantine at home, do so, but in a separate room if you can, in a well-ventilated area. Get as much fresh air in there as you can. Double bag and throw away all waste products, including tissue, toilet paper, paper towels, urine, and feces. All of these are contaminated. If you have a fever, it's suggested to ride it out and not take NSAIDs like acetaminophen to reduce the fever. The fever is your body's way of supercharging the immune system. By lowering the fever, you lower your body's ability to activate its immune system and fight the disease. If you feel hungry, eat. If you don't eat. In either case, drink plenty of fluids to stay well hydrated. Don't share cups and utensils. Keep warm. If take Imodium or some similar product to control diarrhea if you get it. Again, diarrhea is a source of dehydration, and it's common when you have that to become dehydrated, so drink as many fluids as you can. Have some games, books, playing cards, etc. on hand to occupy your time. You know, coloring books are not just for kids. They're time-consuming, entertaining, and therapeutic for adults, too. You don't have a coloring book? I'd be willing to bet you have some blank paper and a pencil. Take up drawing. It's a way to occupy your time. Here are some steps if you are caring for someone sick. If they are in a separate room, leave food and drinks outside the door, step away, and call to the person to pick up the food after you step away from the door. Have them do the same when they are done. This is what Wuhan apartment dwellers have suggested, and it seems to be controlling it. You want to keep that infection in one room as much as possible. If you have to go in the room, wear a mask, gloves, foot coverings. You can use plastic grocery bags to cover your feet. Hold them in place with tape or rubber bands, and strip those off on your way out the room. Clean your way into the room and clean your way out of the room with disinfectant. Use extreme caution removing gloves and face masks. Disinfect your gloves first before removing them. One thing you can do to practice, if you have a face mask, if you have gloves, put them on and then put flour or talcum powder, something like that, on there, and then try to take them off without getting any powder on your skin. That powder represents infection, and the better you can be at taking those off, the more careful you can be. If you can't get masks, they can be made from HEPA furnace filters or even from pop bottles and charcoal. There are YouTube videos that show this. Don't forget to double bag and immediately throw away any waste products. Some of the YouTube channels and websites that I've found to be very helpful, first and foremost for me, is Dr. John Campbell. He has a YouTube channel. He posts a couple times a day, and it's all fact-based, all science-based, and he gives great advice. Dr. Paul Cottrell, Dr. Mike Hansen, a YouTube channel called MedCram, which was originally designed, I understand, for medical students to help them learn better, but they've been covering COVID-19 very closely. And Dr. Bones and Nurse Amy YouTube channel is also a great resource. Many of you may already know Johns Hopkins University has, they call it a dashboard. It's a running total of the infected, the people who have been recovered, and the deaths. And that's listed by geographical area. So too does Worldometer. And that site tracks this as well. the WHO, World Health Organization website, the Lancet website. Lancet is a professional magazine for healthcare providers in England. It's the equivalent of the New England Journal of Medicine for England. They have excellent resources. JAMA, the Journal of the American Medical Association website. Worldometer, as I said before, and MedCram also has a website. And I'm trying to learn editing, but there's the list that I presented. And also the government now has one called coronavirus.gov. These are just some of the things I've been able to pick up. We can get through this if we all work together. I think what all of us need to do is prepare ourselves 3 ways. We need to prepare ourselves physically. Get as much sleep as you can, eat as healthy as you can, exercise. You know, it's interesting. My daughters belong to gyms. They're very much into healthcare. They run races. And I told my one daughter, I said, you know, it's interesting. Some of the most physically fit people in the world are prisoners and the military, and they don't go to gyms. You can do sit-ups, push-ups, a host of different exercises, and there's many YouTube channels that show this right in your home. So we need to prepare physically. We also need to prepare mentally. We've already seen our lifestyle has changed. Dr. Fauci of the NIH, National Institute of Health, is saying this could last for months, and I think he's right. So we need to prepare ourselves mentally for that reality and change some of our bad habits. I think we need to also prepare ourselves spiritually. Whatever your view of God is, this is a time to renew your relationship with Him. Spend some time in prayer. You know, prayer isn't just talking to God, it's also listening to Him. And prayer and meditation are very important parts of my life. And that's a time where I gain peace. I've come to realize over my life that nothing, absolutely nothing, happens by accident. And so if something's happening in my life, it's happening for a reason. But I've also come to realize that in almost 60 years of life, I have never once gone to bed in legitimate need. I've gone to bed and want a lot. I want a new car. I want a new cell phone. I want a new job. I want a new house. I want. Many of those wants have been given me over my lifetime. But never once have I gone to bed in need. And I think this is probably true for most of us. If you're watching this, you're alive, you're breathing, your needs have been met. And so I think this is a time when we can either draw into ourselves and become selfish and self-centered, or we can be better people than we are. And it's my hope and my prayer that that's the type of people we become. Remember, real men pray, and I pray that God watches over, protects, and blesses you and yours always. Peace.